Hi everyone, welcome to In the Waiting Room with Doctors Yaz and Sam. So today we're going to talk about medical tips when visiting your doctor and making the most out of that usually short time period. Okay, so tip number one is just choosing a doctor. So these days most insurance companies have a website that you can log in and access your plan and you can find a doctor. Now, just know that you usually have to choose a PCP that's assigned to you for the whole year, and you can change it, but there's usually a 1 or 2 month lag period before you can see that PCP. So when you choose your PCP, if you want to get recommendations from family and friends, that's always nice. Otherwise, if you're choosing it randomly, they usually have a brief synopsis of where they did their training, and you can see if they're in your network through the website. Usually they'll give you a list of doctors that are in your network, which is usually cheaper. And then when you make your appointment and you go see the doctor, just take a list of all your current medications, and even more ideally, you should take the bottles with you, particularly if you're going to need a Schedule I drug such as pain medication or anti-anxiety medications. The doctor will usually want to see that you're already on it. If you just want to refill, otherwise they'll have to evaluate you starting from scratch to see if you need that medication. Whereas if you just bring the bottle, they know you've been on it and it might just be easier for them to prescribe it to you. They can also check the Cure's website, but again, that would take them longer, and so they may need to get back to you on writing your script. Okay, if it's a follow-up visit with your current doctor, it's always a good idea to make a list of 2 or 3 problems or specific items that you need to discuss with your doctor so that you don't forget when you get there. And if you have specific questions about your care or something you read or a new symptom you're having, it's always, again, a good idea to write it down. Just because that saves time during the visit, you can basically cover more ground during the short, usually 15 to 20 minute office visit you have with your primary care doctor or specialist. Right, Yaz?
Exactly. So those are great tips when you're looking for a new doctor. Also, you probably want to look for a woman doctor if you're a woman, or a male doctor if you're a male. So just having a network in mind is great.
Okay, and then again, along the same lines, keep notes if you're running low on medications so that you can remember to get those particular ones refilled. Also, if you start a new medication, then it's a good idea to write down if you notice any particular side effects or symptoms that you're having, so that when you see the doctor 3 or 4 weeks later or 8 weeks later, you remember that you had that side effect, because otherwise you might not remember. Also, if you start a new medication, there's a lot of online websites that you can go on to check for medication interactions. And this is always a good idea for you to check your own list of medications. And these days it's so great because you can go online and do it yourself. And you can also, that way you can also include any over-the-counter medications that you might take as well. And if you have any chronic condition where your doctor asks you to monitor the levels at home, again, it's always a good idea. You can put it in your phone, or you can put it, write it down on a piece of paper and then take those numbers with you, because that helps your doctor know what's going on at home, and so that they can more precisely adjust your medication regimen to optimize your care and your outcome. Another tip is that if someone is in an emergency type of situation and you're calling the paramedics or any emergency personnel or the cops, and that person in turn, if they're a relative or friend or family, ends up having to be transported to the hospital, it is a really good idea if you can give a list or relay what medications that person who you know is currently taking, because oftentimes that person may not be in a state of mind where they can talk or remember or relay that information to the police. So if you tell them what medications they're on, this actually optimizes their care, because the emergency personnel will relay that information to the ER doctor, they usually write it down and give that sheet to the ER doctor so the ER doctor can immediately resume the patient's medications. Otherwise, there'll be a delay of a day or hours where they don't really know what medications that patient is on, and so then they kind of have to evaluate as they go until they can get a hold of someone who can tell them.
Sometimes it's good for elderly or psychiatric patients is just to have a note inside the wallet with all the medications, medical conditions, allergies, everything that's happened in the past. And that just helps us to kind of know what's going on so we don't have to get in touch with someone urgently and whatnot.
Another great tip is that although the electronic medical record is widely prevalent throughout the healthcare system, whether it's an outpatient clinic or imaging center or pathology lab, each facility often uses a different electronic medical record system, and they do not necessarily communicate with each other. So it's always a good idea if you get a procedure done or a biopsy done or a surgical procedure done or just even an office visit to get your medical records, which can be usually burned on a CD or copies made for you at a minimal or no charge, and just take it with you so that when you can, and to always give a copy to your primary care doctor's office so they can add that to your chart, because otherwise they're not necessarily going to have access to that information. And you can also, keep a copy of it for yourself at home. So, because sometimes people don't realize that their doctor's office doesn't have immediate access to these other facilities. And in terms of other tips, which we're going to elaborate further on another episode talking about psychiatric care, but it's also a good idea if you're on medications, particularly Schedule I medications or anti-anxiety medications, to know your local laws regarding these medications because they can be very specific. For example, if you're traveling with the medications or you have them in your car, then, they precisely need to be written out to your name. Otherwise, there can be some legal ramifications that you're not expecting. So it might be a good idea just to look it up and just be knowledgeable that they are widely regulated. And so you don't want to just get caught just because you didn't know something. But we'll talk about that further. We hope you enjoyed today's episode, and there's a lot more to come. If you have any suggestions about topics you would like us to discuss, just email us at inthewaitingroomys@gmail.com.
Bye for now.